We were told that eating saturated fat raises our total cholesterol and the LDL, the so-called bad cholesterol, that increases our risk of cardiovascular disease. The World Health Organization, the American Heart Association, the NHS, National Health Service, and other health organizations have been promoting the low-fat, low-saturated fat dietary advice for weight loss and prevention of most common chronic health conditions, such as type 2 diabetes, cancer, and cardiovascular disease. For the purpose of this video, I'm going to mainly be focusing on saturated fat, cholesterol, and cardiovascular disease. In this short video, I'm going to cover the scientific evidence, briefly discuss the purpose of cholesterol in the body, explain what is LDL cholesterol, the role of saturated fat and cholesterol in relation to cardiovascular disease, and then you will be able to make an informed decision whether you should avoid saturated fat and cholesterol or not. Just a quick explanation before I start. Cardiovascular disease is a term used for all types of disease that affect the heart or blood vessels, including coronary heart disease, which is clogged arteries, which can cause heart attacks, stroke, and various other health complications. By the way, if you're new to my channel, I'm a nutritionist and a health coach who is all about providing you with the best science-based health and weight loss advice. So if you're interested in staying healthy and fit, don't forget to like this video, subscribe to my channel, and click the notification bell so that you would get notified whenever I release new videos. First, let's look at what is cholesterol and what's the function of cholesterol in our bodies. Cholesterol is a vaccine-like substance that's found in all cells in your body. Cholesterol is a structural component of cell membranes. Your body needs cholesterol to make hormones, vitamin D, and substances that help you digest foods. We get cholesterol in two ways: by eating cholesterol-rich foods such as egg yolks, meat, and cheese, and our bodies make their own cholesterol to meet the daily needs. The average 70-kilogram adult synthesizes around 850 milligrams of cholesterol a day, so most of cholesterol comes from your body and not from the diet. Cholesterol is water-insoluble, and it has to be wrapped in proteins called lipoproteins, so that it could travel through the blood to where it needs. It actually carries nutrients and energy to your cells. It carries fat-soluble vitamins such as A, E, D, and K. And lipoprotein is basically a protein shell that holds fat. Two types of lipoprotein carry cholesterol through the blood. We have HDL, high-density lipoprotein, and LDL, low-density lipoprotein. And so how do they work? They work together in a cycle. LDL carries new cholesterol to the cells, and HDL takes the old cholesterol back to the liver for recycling. So our bodies not only make their own cholesterol, but also recycle all the used cholesterol. Between 92 and 97% of the cholesterol in bile is reabsorbed from the gut and recycled back to the liver, where it can be reused. Interesting, why is the body making its own cholesterol and recycling it if it's that toxic? And then high total cholesterol and elevated LDL cholesterol are thought to be at the root cause of cardiovascular disease. This recommendation to lower your total fat intake and saturated fat intake remains unchanged for decades, and many of us have never questioned the scientific evidence to support this claim. If everyone says it, your doctor, your dietitian, you see it on the TV, you go food shopping and you also see everywhere in the labels, lower fat, healthier option, you probably have no doubts. If everyone says it and does it, it must be right. I remember being a nutrition student. I constantly heard my lecturers saying that eating fat and saturated fat causes heart disease. However, while doing one of my courseworks, I wanted to find some research studies to support this point that saturated fat causes heart disease, and that's why we're supposed to lower our dietary fat and saturated fat intake. But I couldn't find any proof. I couldn't find any real evidence to prove it. The only evidence that I found was the statements made by these health organizations. I checked the NHS website. Here's what they say. Too much fat in your diet, especially saturated fat, can raise your cholesterol, which increases the risk of heart disease. And are there any references? Interesting, no references. Okay. So I checked American Heart Association. That's what they say. Eating foods that contain saturated fats raises the level of cholesterol in your blood. High levels of LDL cholesterol in your blood increases your risk of heart disease and stroke. No references as well. I was like, okay, so where's this coming from? So I had to do some serious investigation because I'm not that type of person who you tell a serious scientific fact and you don't have any evidence. And now I'm gonna go and use it in the future with my clients. I need some proof. So I started my search. I had to check the studies that prove the claim that dietary fat, dietary cholesterol, and saturated fat raises your total cholesterol, your LDL, bad cholesterol, and increases the risk of cardiovascular disease. And just before we get into the scientific evidence, I want to explain what's considered a high-quality scientific evidence. So the gold standard is a systematic review and meta-analysis of randomized controlled trials. That is basically a result of several well-controlled experimental studies combined. So normally to prove something, you would have to have a systematic review and meta-analysis of randomized controlled trials. However, in the nutrition field, it is often impossible to conduct these very long controlled studies, and mostly observational studies are used to determine whether something is good or bad for you. And these type of studies often collect the data by calling the participants over the phone once a year or even less frequently and ask them what did they eat this year. Then let's say someone ate some butter with bread and jam occasionally, or at least that's what they remembered. And they developed heart disease in, let's say, 10 years. Maybe this trend has appeared in more people. So, as the study was conducted to assess dietary fat and heart disease risk, they would publish the study saying that people who ate butter were more likely to develop heart disease. However, this study does not prove anything because person ate various foods over these years and it is unclear what exactly caused heart disease. Is it the butter? Is it the bread? Is it the jam? Or is it eating a combination of all of them? So take all observational studies with a grain of salt, because some will be better than others. So here are some of the studies that I found on saturated fat or cholesterol and cardiovascular disease or coronary heart disease risk. So I found a lot of studies where they proved that saturated fat increases the LDL cholesterol. That's what I found. And then they just assume that it increases cardiovascular disease risk. For example, this one. Dietary lipids and blood cholesterol, quantitative meta-analysis of metabolic ward studies. And their conclusion was, in typical British diets, replacing 60% of saturated fats by other fats and avoiding 60% of dietary cholesterol would reduce blood total cholesterol by about 0.8 millimolars per liter, with 4/5 of this reduction being in low-density lipoprotein cholesterol. Then I looked more and found these studies that actually looked at the risk, not the increased LDL cholesterol. So the first study, meta-analysis of prospective cohort studies evaluating the association of saturated fat with cardiovascular disease. They start by saying that a reduction in dietary saturated fat has generally been thought to improve cardiovascular health. And so their objective was to summarize the evidence related to the association of dietary saturated fat with risk of coronary heart disease, stroke, and cardiovascular disease in prospective epidemiological studies. And they included 21 studies. The results showed that during 5 to 23 years of follow-up of around 350,000 subjects, 11,000 subjects developed coronary heart disease or stroke, and that the intake of saturated fat was not associated with an increased risk of coronary heart disease or stroke or cardiovascular disease. Their conclusion was, a meta-analysis of prospective epidemiological studies showed that there is no significant evidence for concluding that dietary saturated fat is associated with an increased risk of coronary heart disease or cardiovascular disease. Then there's another meta-analysis. Dietary total fat, fatty acids intake, and the risk of cardiovascular disease. A dose-response meta-analysis of cohort studies. By comparing the highest versus the lowest categories of fat or fatty acids intake, They found that higher dietary trans fatty acids was associated with increased risk of cardiovascular disease. However, no association was observed between total fat, monounsaturated fat, saturated fat, and polyunsaturated fat and risk of cardiovascular disease. Okay, so the risk for cardiovascular disease is not increased with more fat and saturated fat. Then next, meta-analysis looking at dietary cholesterol. Dietary cholesterol and cardiovascular disease, a systematic review and meta-analysis. And they say dietary cholesterol has been suggested to increase the risk of cardiovascular disease, which has led to US recommendation to reduce cholesterol intake. They included 40 studies, 14 cohorts with around 360,000 subjects and 19 trials with 632 subjects. And their results showed that dietary cholesterol was not statistically significantly associated with any coronary artery disease or stroke. So, dietary cholesterol statistically significantly increased both serum total cholesterol and low-density lipoprotein, LDL cholesterol, and it did not increase the risk of coronary artery disease or stroke. Interesting, that's not quite matching with the recommendation to lower your total fat, saturated fat, and dietary cholesterol. I just showed you 3 meta-analyses showing that saturated fat, total fat, and dietary cholesterol have nothing to do with cardiovascular disease. And are there any well-conducted randomized controlled trials showing that a low-fat diet decreases the risk of cardiovascular disease? There must be something. Oh, actually, there is one large randomized controlled trial. So, the largest and the longest 8-year duration randomized controlled trial assessing the effect of low-fat diet on the risk of cardiovascular disease did not find any evidence to support that reduction of dietary fat could help to reduce the risk of cardiovascular disease. That's quite a lot of evidence to support that saturated fat has nothing to do with cardiovascular disease risk. Is there anything else? Let me think. Oh, I know. What about the low-carbohydrate, high-fat ketogenic diet that is high in fat and saturated fat? This diet mostly consists of 70% or more calories from fat. People eat butter and coconut oil. They eat fatty cuts of meat. They must have increased risk of heart disease. Let's have a look. Okay, so there's this meta-analysis of randomized controlled trials. Very low carbohydrate ketogenic diet versus low-fat diet for long-term weight loss, a meta-analysis of randomized controlled trials. So the present meta-analysis aimed to investigate if individuals assigned to a very low carbohydrate ketogenic diet, which is a diet with no more than 50 grams of carbohydrates a day, achieved better long-term weight loss and cardiovascular risk factor management when compared with individuals assigned to a conventional low-fat diet, that is a diet with restricted energy and less than 30% of energy from fat. Basically, they checked which diet is better for long-term weight loss and reduction of cardiovascular disease risk. They included only studies with at least 12 months follow-up. The primary outcome was body weight. The secondary outcomes were triglycerides, HDL cholesterol, LDL cholesterol, systolic and diastolic blood pressure, glucose, insulin, HbA1c, and C-reactive protein levels. Individuals assigned to a very low carbohydrate ketogenic diet showed a decreased body weight, triglycerides, and diastolic blood pressure, while increased HDL cholesterol and LDL cholesterol. So, wait a second. If all the studies show no link between high-fat diets, saturated fat, LDL cholesterol, and heart disease, where is this recommendation coming from? We have to look back to the time when these dietary recommendations were first released in the US and UK and the rest of the world. This happened in 1977 and 1983. That's the time when the first dietary guidelines recommending to reduce dietary cholesterol, saturated fat, and total fat were introduced. Let's see what evidence did they have at the time. Here's a study called Evidence from Randomized Controlled Trials Did Not Support the Introduction of Dietary Fat Guidelines in 1977 and 1983, a systematic review and meta-analysis. And they start by saying, national dietary guidelines were introduced in 1977 and 1983 by the US and UK governments, respectively, with the ambition of reducing coronary heart disease by reducing fat intake. And to date, no analysis of the evidence base for these recommendations has been undertaken. The present study examines the evidence from randomized controlled trials available to the US and UK regulatory committees at their respective points of implementation. So they conducted a systematic review and meta-analysis of randomized controlled trials published before 1983, and it looked into the relationship between dietary fat, serum cholesterol, and the development of coronary heart disease. So it shows that there was a total of 2,467 male participants, and that's not a lot. And there were 6 dietary trials, and 5 of them were secondary prevention studies, and 1 included healthy participants. And what is a secondary prevention trial? Secondary prevention aims to reduce the impact of a disease or injury that has already happened. So these are people who probably already had a heart attack or a stroke. So for introducing these dietary guidelines, they use the evidence from such a small sample size, only 2,500 people. They were only men, and most of them were not healthy adults. They were people who already had cardiovascular disease. And is it a strong and relevant evidence for the rest of the world? What about healthy women, healthy men, kids? Absolutely not. There were no differences in all-cause mortality and non-significant differences in coronary heart disease mortality, resulting from the dietary interventions. Yes, the reduction in mean serum cholesterol levels were significantly higher in the intervention groups, but this did not result in significant differences in coronary heart disease or all-cause mortality. And as we see now, all recent studies also show that reducing dietary fat and cholesterol is useless. It does not reduce your cardiovascular disease risk or protect you from death. So now let's go back to the LDL cholesterol, the so-called bad cholesterol. That is not even cholesterol. It's a protein. Is there anything wrong with it? LDL is only dangerous if you oxidize it. You probably heard terms free radical and antioxidant in the past. It has something to do with it. How do you oxidize your LDL cholesterol? Simple. When you have a diet high in sugar, other refined carbohydrates, refined vegetable oils, and combine high-fat foods and high-carbohydrate foods, you end up having a lot of oxidized cholesterol and increased risk of cardiovascular disease. Oxidized lipoproteins can be a better indication of arteriosclerosis than the normal healthy LDL particles, and increased blood glucose concentrations can induce that oxidation of the LDL lipoproteins. Atherosclerosis is not caused by the amount of cholesterol carried by LDL, but by oxidative damage to weak cell membranes, which are a result of a diet that is too high in polyunsaturated fatty acids and too low in saturated fatty acids. Just look at this meta-analysis of randomized controlled trials. Dietary sugars and cardiometabolic risk. Systematic review and meta-analysis of randomized controlled trials of the effects of blood pressure and lipids. A higher sugar intakes significantly raised triglyceride concentrations, total cholesterol, low-density lipoprotein, high-density lipoprotein, and blood pressure. And when sugar raises your LDL, it's not the same LDL as you would have from saturated fats. Instead, you get these small, dangerous LDL particles that can increase your risk of cardiovascular disease. By the way, I will leave all the studies that I discussed in the description of this video. So, how to prevent cardiovascular disease? Eat a diet high in nutrients. Avoid sugar and other refined carbohydrates, such as white rice, pasta, and bread. Stay away from sodas, both the ones with sugar and the ones with artificial sweeteners. Avoid vegetable oils, such as canola, corn, sunflower, and all the others. Avoid trans fats. If you eat meat and other animal products, make sure they are high quality, organic, grass-fed, or wild. Replace all vegetable oils with natural saturated and unsaturated fats. Use fats such as grass-fed butter, ghee, extra virgin olive oil, and organic extra virgin coconut oil. Eat natural whole foods. Include enough of vegetables in your diet. Aim for 5 to 10 servings of vegetables a day. Eat a variety of raw and cooked veggies. The most important thing here, don't eat sugar and other refined carbohydrates, and you won't have that increased risk of cardiovascular disease. And if you want more tips on healthy eating, feel free to watch my other videos. I hope you found this video useful. If you've enjoyed this video, don't forget to like and subscribe to my channel. And you can also support my YouTube channel by buying me a coffee. There's a link down below in the description of this video that you can click on and donate a small amount to keep this channel going and creating educational videos that can help millions of people. So thanks so much for watching, and I hope to see you in the next video.